Hello and welcome back to World Health plus Social Good. I'm Vismita Gupta-Smith and we're coming to you live from the 70th World Health Assembly here in Geneva, Switzerland. In today's show, we're going to talk about WHO's role in emergencies, about how climate change is impacting your health and antimicrobial resistance. So don't forget to send us your questions. You can feed in your questions on our Facebook Live feed, on Twitter. Please use the hashtag WHA70 and hashtag social good. Pinky Patel from UN Foundation is standing by to take your questions. Hello, Pinky, welcome. Now, in recent years, at the World Health Assembly, member states have focused heavily on WHO's role and our work in emergencies. In 2015, the focus was the slow response to Ebola. In 2016, member states reviewed the reform work that we had undertaken to improve our response in emergencies. And this year, once again, emergencies, our reform and our performance in response in emergencies is again near the top of the agenda. Now, WHO works in several different kinds of emergencies. There is the humanitarian response to natural disasters and conflicts, in which there are many partners that we work with on the ground, because usually the need is so high and so much help is needed that no one organization can do this alone. Then there is the response to outbreaks. This really is our specialty. This is the area where we work with our partners and lead the work. Now, I have here a very special panel, Dr. Matshidiso Moeti, Regional Director for WHO's Africa region, and Dr. Roderico Ofrin, Regional Emergencies Director for WHO's Southeast Asia region. Welcome to both of you. Dr. Moeti, let me start with you. Your region sees disease outbreaks periodically, and you have a very experienced team which has dealt with many responses. For instance, Ebola, your region has faced almost 15 outbreaks now. Most people know about 2 Ebola outbreaks. So let's discuss, for instance, the Ebola outbreak which is going on in the Democratic Republic of Congo. As soon as the first case was confirmed, you were on the ground. Tell us about the situation there and the response that's going on.
Yes, thank you for having me to speak to you. I was very impressed, first of all, by the speed with which the government in the Democratic Republic of the Congo took action on this outbreak. Within 24 hours of the first case being confirmed, the minister had made the declaration, had called in the WHO representative and a number of partners, and had sat down with them in his office on an evening to start working on a response plan. I was able to go across the river and visit within a day and a half of this declaration being made. And when I got there, I was really impressed that it was a Saturday. A whole lot of partners were gathered in the ministry, now working together in a broader group to see what they can do together. The governor of Bawele province, where the epicenter of this epidemic is, was also in the city. He'd come over to start talking to the minister. So what has impressed me the most is the speed, the determination of the government, the minister, and of the partners on the ground to respond.
Dr. Moeti, describe to me what was different this time compared to previous outbreaks.
Yes, I think on the WHO side, our reform is definitely showing its results already. We were able, within a day, from our country office to deploy a team from a district-based office, from a supplementary office in a district out to the field where this outbreak is taking place. We were able, within 24 hours, to mobilize some funding from our contingency fund to be able to start moving people into the country. Within a couple of days, our team, working with the minister and his team, had managed to move from Kinshasa out to the field, and we've been able to deploy within a very short space of time a WHO team composed of people from the regional office, from headquarters, and from the country office to go locally to start working on this outbreak. That is unprecedented.
Let's take some questions from our audiences. Pinky?
Thank you, Vismita. Dr. Moeti, we're getting a lot of questions about cholera outbreaks and how WHO activates the cholera vaccine stockpile. Could you address how this system works?
Yes, we do this with a number of partner agencies, with UNICEF, with MSF. There is a group called the International Coordinating Group that manages the stockpile of cholera vaccine. And what is supposed to be done with this is to use it very early in an outbreak, and it's not a vaccine that we use in endemic countries in a routine type of way. So when there is an alert of an outbreak, we are able to convene the ICG, as it is called, and it then makes a decision about releasing some vaccines from the stockpile. In the last couple of years, I believe that about 8 million or so vaccines have been made available to more than 40 outbreaks of cholera to be used.
Dr. Moeti and Pinky will take more questions. Let me bring in Roderico. Roderico, we also are helping people who are caught up in humanitarian emergencies in more than 20 countries globally right now. And in the Southeast Asia region, there are a lot of natural disasters that happen. Nepal earthquake is perhaps the most recent, more well-known example of this. Now, when a natural disaster happens, many things are disrupted. What is WHO's role in that initial phase?
Maybe before I explain to you what is our role, it's to paint a picture of what really happens. Let's say there is an earthquake, like what happened in Nepal. Within those 55 seconds, 400 health facilities collapsed. Your own health workers are affected. Then it takes a lot for the country, for the community to be able to respond. Now, what changes that is how well prepared you are. So let's say from 0 hour, within a few hours, district officials as well as ministries of health would mobilize their assets, people. The military was out there with their medical teams sending out supplies. Hospitals were very busy referring patients back to the city. Then maybe within another day, all your other neighboring countries providing help came, including us as WHO surging to the country office to help support the operations for the Ministry of Health. So as the week goes on, you will have more partners coming in. By the end of 2 weeks in Nepal, we had 142 emergency medical teams. We had close to 100 health NGOs working with us to provide the health services. The role then of WHO is to bring coordination, because it could be a mess. You don't want duplication of services in a particular district and then have nothing in another, or you don't want everyone doing healthcare or medical services and forgetting about surveillance. So this is our key role. It's really to provide a coordination of all health partners together with the Ministry of Health, set up a plan, a strategy, because we have to do a rapid assessment. That's another thing. Although we know an earthquake can happen in Nepal for the past 10 years, for decades, what we need to do is to find an exact picture of what actually happened.
I was going to come to that even though natural disasters are unpredictable, we can prepare for disasters.
Exactly. And that's part of, I'll go a bit jargonish here with the UN thing of the Sendai framework. The whole overall objective of the Sendai framework is understanding risk. And that means you and me understanding the risks of where we live. So we very well know that Nepal, for example, is in the Himalayan fault. So knowing your risks, planning around a possible event with a scenario, knowing the health impact of that scenario is what you prepare for. Knowing where to put your health supplies, where are the designated open spaces people can go, what are the possible health impacts of an earthquake. Is it a possible cholera outbreak? Is it too many injuries where you might not have enough health supplies for certain health facilities to do operations? So these are the things you plan for, and Nepal was good with that. It's decades, and it's quite something of pride for Nepal that 6 of their hospitals in Kathmandu, because of retrofitting, because of non-structural interventions, kept functioning during that earthquake and serving the patients that came during those first 24, 48 hours.
I want to go back to what you were mentioning about coordination. When a disaster happens, agencies, partners, everyone rushes to the country because so much help is needed. Explain to me the challenges of coordination so that the number of people who have come in to help can actually help in a coordinated manner and not hinder the response.
First, there must be a willingness to be coordinated, and that you have to set up and enable that part to happen. So from the airports itself, for example, whether it was Typhoon Haiyan on the Philippines or the Kathmandu airport, there is a one-stop shop that we set up for all health NGOs to register, so we know where that you have arrived, and we know where you can be placed, so that, again, as I said, no duplications or gaps. From there are regular meetings. What is it that your team can do? And therefore, we match you where the need is. So, for example, let's say a foreign medical team will arrive and they are capable of doing operations. Then they're set up to a district where trauma care is needed. If you are an NGO then that is specialized more with mental health support, psychosocial support, or psychosocial first aid, they call it, then we bring you to areas where you can serve that population. But it's also for us, it's a responsibility also of WHO to match with local needs. It's not always that external help comes that it can always be helpful. There are language barriers, there are cultural issues around all of this. So we're very careful about all those things. And that, again, is part of your preparedness planning and your simulations around your preparedness plans.
Let's take a question from our audience. Pinky?
We have a question from someone in Nigeria who is asking about how do you work in different areas when there is an emergency in a rural area versus an urban area, and if you could speak to some of those differences.
Perfect question. I think that's a challenge of the 21st century, is that natural disasters that occur in urban areas are more vulnerable because of population density to begin with. The difference with a rural area is that you might not have access. I've seen this in Cyclone Sidr, Cyclone Nargis, where it took a few days to clear up the road or get a boat to where we should be. So that's all part of your preparedness planning or planning for risks around the possible health outcomes that come out of these natural disasters. In urban areas, well, the other thing is to use information technology. We live in these days where it's driven by your mobile phones, your smartphones. So sending health risk messages is key. That is also happening now more and more in rural areas, but the stark differences is actually the number of people and how we plan for that volume of people that might actually be affected.
Well, thank you both for making the time to come on our set today. Now, WHO's work in this area will likely increase because one of the drivers of some of these emergencies is climate change. In fact, climate change causes significant weather changes like heat waves, floods, and droughts. It impacts human health. Many factors are linked to human health. For instance, clean air, safe drinking water, sufficient food, and secure shelter. Now, between 2030 and 2050, climate change is expected to cause about 250,000 deaths per year. And these deaths are likely to occur from conditions like malnutrition, diseases like malnutrition, malaria, diarrhea, and heat stress. Joining us now to talk about this is Dr. Poonam Khetrapal Singh, Regional Director for WHO's Southeast Asia region. Welcome. And Dr. Neira, Director of WHO's Public Health and Environment Department. Thank you very much for joining us. Maria, let me start with you. Give me the global picture. 250,000 deaths per year. Which parts of the world are most likely to be affected?
I think it's important to stress that we are all...
Let me give you the mic, Maria, sorry.
I'm
Please, go
sorry.
ahead. Mhm.
I think it's important to stress that we are all at risk. Of course, there are certain countries, certain regions of the world that are more vulnerable because they don't have good healthcare facilities, good and resilient health systems, because of the poverty, because the capacity they have to adapt, to take measures to mitigate. But we are all at risk. Obviously, the people who contribute less to cause climate change are the ones that are more affected. If you look at the African continent, for instance, their contribution to the emissions of the green gases is very limited, while most of the consequences in terms of a negative health impact is going to them, and the same for the Southeast Asia and other parts of the world. Yeah.
Well, the Assembly is a very busy time for most of our senior staff, and it's very difficult to slip out and take time. So Dr. Khetrapal Singh, I know you have to leave soon, but thank you very much for taking the time to join us. Building on what Maria said, can you please highlight some of the countries in your region which are likely to face the impact of climate change?
We do find in the Southeast Asia region that the intensity and the frequency of weather-related events are on the increase. And in that context, I find that floods, storms, heat waves are increasing. Floods we find in countries like DPRK, India, Myanmar, which were affected by floods in 15-16, but all countries of our region really are floods prone. We also find an indirect impact on the ecosystem. So, vector-borne diseases, waterborne diseases are on the rise. Apart from that, there are droughts in the region, which then lead to heat waves and mental stress. So there is an increase in the effect of events which are related to climate change. When there are adverse weather events, we do find that health facilities get damaged. And that affects really the provision of health care to the people of that country, as we saw in Nepal recently. We have also seen in Nepal that a 1% increase in mean temperatures leads to a 25% increase in malaria incidence. So this relationship is so very clear.
Now, Dr. Khetrapal Singh, can you please tell us about some of the efforts that Asian governments in that region are making to minimize the impact of climate change on health?
All governments are very concerned about it. And this year, when we have our regional committee in Maldives, there is a ministerial roundtable.
Sorry to interrupt. Could you hold the mic a little
There
closer?
is a ministerial roundtable around climate change and health, where every country of our region is going to share the efforts that they are making towards this. All countries are really trying to see how to reduce greenhouse gas emissions. And I have noticed that there are concerted efforts in countries to see how they could switch to transportation, which is not really going to pollute the environment. And therefore, there is a lot of stress on walking, cycling, reducing automized vehicles. We also see that all countries of our region have prepared. Some have already prepared, and some are in the process of preparing health national action plans. And Bhutan is one example, which has already completed a 5-year health national action plan. Maldives is working on one. Thailand, India, Nepal, Myanmar are all in the process of working on this. So there is a very concerted kind of effort in all countries of our region to see how they can adapt to this. Of course, one major constraint is resources. They all need more resources for it. And we in the region are trying to see how we can tap on resources that are available for this worldwide and help and support countries of the region.
Well, I know I have to let you go, Dr. Khetrapal Singh. Thank you very much for joining us. Maria, to continue our conversation, Tell me the connection between climate change and air pollution.
Okay, when you look at the causes of climate change, the emissions of the greenhouse gases, those emissions are coming, some of them are coming, for instance, from industrial production, or are coming from the transport sector, or are coming from the way we use the energy in our buildings. All of this is as well contributing to generate pollution in the air we live, and they are very much linked to the particulate matter that it will go in our lungs and in our bloodstream and then causing the diseases that we know. The connection is that if you tackle the causes of climate change, somehow you can have a fantastic positive effect on reducing the causes of air pollution and therefore contributing enormously to the health benefits that can be obtained from that. So somehow there is an overlap between the two agendas, the climate change and the air pollution, and this is what we are trying to stress, because for health, this is very much something that has to be, the causes have to be tackled in order to reduce the very negative impact on the health of the people that both are having.
Maria, I'm going to take a question from our audience, but before that, how many people are killed by air pollution?
Okay, I'm very happy that you are asking me this, because it's a dramatic figure. Every year we have 6.5 million premature deaths caused by exposure to air pollution. And this is something that goes against any public health approach. This is representing now one of the biggest public health issues we are dealing with, because this air pollution is responsible for a big percentage of the non-communicable diseases that are causing us now major challenges on the global health, plus infectious diseases that have been representing a problem for a while as well. So unless we promote this idea of tackling air pollution, we will not solve the problems on global health at the moment.
Let's go to the audience. Pinky?
So we have a question from Shariha from Malaysia, who would like to know how we work to connect NGOs with local innovators to help bring more tech solutions to scale to address climate change and air pollution.
Okay, I think it's definitely we need very much the involvement and the engagement of the social networks and the society in general and non-governmental organizations. We need then to promote different approaches at the urban level, for instance. We need then to disseminate the importance of tackling the causes of climate change and air pollution. We need then at front to promote recycling, to promote a sustainable transport system at the urban level, to put some positive pressure on their politicians and the keeping, promoting the good interventions, and of course promoting clean fuels and renewable energy. Those are the actions that I think they can be extremely useful in contributing to tackle this major problem of air pollution and climate change.
Maria, thank you very much for joining us today to discuss this very important topic.
My
now,
pleasure.
Another topic of growing concern is antimicrobial resistance. That is when the microbes that make us sick, the bugs that make us sick, learn how to avoid the medicines that we use to kill them. And we see this in bacterial infections, TB, malaria, HIV. There was a high-level meeting on this topic in the UN General Assembly last September. Joining me now to talk about this topic is Dr. Marc Sprenger, Director, Antimicrobial Resistance in WHO, and Dr. Jean-Pierre Paccaud, Director, Global Antibiotic Research and Development Partnership. Welcome to both of you. Marc, let me start with you. So in September, the concept of AMR became more common, more visible because of the high-level meeting. How have things improved? Where are we now?
Yes, that was a very important meeting, and I can say that I'm active for, let's say, 20 years in this field, and all the experts were really trying to get attention for AMR, but it didn't work that well. And only when it got that political attention, things went very well. There was a lot of activities. And what we see now today is that about 80% of the countries do have a plan how to tackle antimicrobial resistance. And that means that they are aware that if the antibiotics are not effective, we cannot, replace hips. We cannot treat cancer because all this modern medicine depends on effective antibiotics.
So Marc, now that there is political will and 80% of the population is covered by national plans, what do we need to do to take these national plans and make it work, bring it to action?
Yes, it's, step one is to have a plan. And you can only make a plan if you really discuss not only between the doctors, but also the political people, agriculture, the vets, all together. Now, we have a lot of actions in these plans, and it's very important that it is not only a plan, but we start implementing the plan. So the countries need to be active in training healthcare people to understand that they really need to restrict the use of antibiotics, that people don't ask if they have just a flu, please give me antibiotics, because that is not necessary. That there is more attention for washing your hands. It sounds very easy, but it's not that easy in a hospital. That we reduce antibiotics in the animal sector. So it's important that we pay attention to all these aspects.
Now, clearly many different sectors have to act on the ground to bring this about. Explain to me how, for instance, our actions that people can take and governments can take, different actors can take, can make a change on the ground.
Yes, so let's start with, ourselves here. If we feel sick, we are always inclined to ask for good medicine. But in fact, a lot of these diseases, a common cold, etc., is just self-limiting. You don't need to have antibiotics. That's one thing that we can do. As a doctor, you can be very much, let's say, restrictive in prescribing antibiotics. Explain that you don't need antibiotics. The governments need to discuss targets. How can we reduce the use of antibiotics? Of course, I'm now talking about countries who do have access to this medicine. There are also countries, the low-resource countries, who do have a lot of infectious diseases. And some of these countries and people don't have access to good antibiotics. So that's the other side. We need to make sure that they have access to these antibiotics.
We're going to talk about that in a minute. We're going to bring in Jean-Pierre in this conversation. Let me go to audience questions.
We have a question from Naomi from the Seychelles, who's making a comment about how, since antibiotics can take a lot of time and can be expensive to create, how do we go back to prevention for antimicrobial resistance? And what are the challenges that you've seen, that you've faced in focusing on prevention, things like hand washing?
Hand washing is very important, but we know that in a hospital, if you go from one bed to another bed, that healthcare people behave like humans. That means that they don't always wash their hands. So it's a matter of discipline. And we really need to pay more attention to this. But also, if we are sick or if you have a common cold, keep a little bit distance. All these quite simple measures are very effective. So that's what we need to do, pay more attention to infection prevention.
Well, you made a reference to the fact that we also need more options in the pipeline. So I want to bring in Dr. Jean-Pierre Paccaud from the Global Antibiotic Research and Development Partnership. This is a joint initiative of WHO and DNDi, and it's it's an innovative initiative that focuses on bringing new antibiotics into the pipeline. Jean-Pierre, tell me why are the new antibiotics not coming fast enough? What are the challenges?
Well, I think one of the main challenges is that we have to find tools that are addressing organisms that have been appearing on Earth 3.5 billion years ago. you can imagine that they are super sophisticated, very adaptive organisms. One of the challenge, or the main scientific challenge, is actually to find weaknesses. These bugs are very, very difficult to manage and to kill because they have been here for much longer than we have.
Now, currently, you're working, your nonprofit organization is working on 3 programs: neonatal sepsis, sexually transmitted infections, and reviewing old research that's been previously explored. How will this fast track the development of new antibiotics in the pipeline?
I think the last program that you mentioned, which is trying to recover compounds that at one point in time have been developed to a certain stage, maybe left alone to look at maybe better compounds or alternative ways, or have been stopped because competition was there before, are compounds we need to look back and see if they are capable of answering today's questions. Maybe 20 years ago they were not, because there were other tools that were available and so-called better. Now we're lacking more and more antibiotics that are efficient, and we have to go back to the old ones, which is actually what's already ongoing in the clinic, but we think there are still something out there to be looked for, and this can be developed very rapidly, while others are trying to crack the nut.
Well, let me see if Pinky has some questions for us from the audience.
We have several questions asking about how we're working to increase education and awareness about antimicrobial resistance in developing countries or in low resource areas.
Yes, I'm very happy that you mentioned the low-income countries, because there is really an issue. They don't have the means to pay attention to this antimicrobial resistance, and at the same time they have a lot of infections. Now the WHO is supporting them in developing their own campaign, because they really need to do it themselves. But we can provide support. We also talk with the professional organizations, the nurses, the doctors, the dentists, how to pay attention in the education to AMR. And that's very important, because they know, if they know how to do that, they will really have a better use.
Let me take one more question from the audience. Pinky?
People are asking about what they can do, like viewers who are just tuning in live to this show, what they can do to help decrease the antimicrobial resistance at home.
Please.
Well, I think many things have been already mentioned. I think infection control and prevention is something that should not be taking place only in hospitals, but I think that patients or future patients should also realize that indeed they should not press their doctor to be prescribed an antibiotic, because it might be completely useless. Clearly, you can also have very simple preventive measures such as hygiene, washing hands whenever possible. I think those are measures that anyone can take, but I think the attitude of the public should change, and they should realize that antibiotics are too precious to be used in the wrong cases and wrong indications.
Well, thank you very much, gentlemen, for joining us. We had planned on talking about non-communicable diseases, spending some time and talking about non-communicable diseases, but the discussions, the deliberations on that topic are going on right now, so our experts can't be here. Now, non-communicable diseases, diseases like heart disease, asthma, diabetes, stroke, they actually are the biggest killers of adults. They cause 70% of all deaths globally, and nearly 40 million people are killed every year by these diseases. Now, one country that's making a lot of progress in combating non-communicable diseases is China. And it's impressive given the numbers that China is dealing with. For instance, as we just mentioned, 70% of deaths globally are due to non-communicable diseases. In China, 80% of the deaths are caused by non-communicable diseases, and smoking or tobacco is actually one of the biggest risk factors, contributing factors to these diseases. We caught up with Dr. Bernhard Schwartländer, the WHO representative to China, to find out what is happening to combat non-communicable diseases in China, and especially smoking and tobacco use. Let's take a listen. Bernhard, first let's start with the context. If you could paint me a picture of how prevalent tobacco's use is in China.
I would like to give you just a few short numbers. 50% of men are smoking in China. That's every second man walking on the streets in China is a smoker. Almost half of all cigarettes globally are being produced and consumed in China. So that's almost half of all cigarettes in the world are being smoked in China. 80% of young students, 13 to 15 years of age, are actually regularly exposed to the second-hand smoke, to the deadly fumes of smokers. And that shows you the magnitude. It actually claims 1 million lives every year, and this number is going to double over the next 15 years until drastic measures have been taken.
Now, those are staggering numbers, especially considering the size of China and the number of cities that are there. How do you tackle a problem like this and change behavior when the magnitudes are so big?
It's obvious that a health problem of that magnitude that is fundamentally linked to behavior cannot be just addressed with one intervention. So there's a set of interventions which actually is very well described also in the Framework Convention on Tobacco Control, which starts with, of course, increasing the price for cigarettes. Cigarettes are extremely cheap still in China, and with the rises in income, they have actually become more affordable over time, not more expensive. So we need a massive increase in taxes to really have an effect, especially on young people and the poor, who are hardest hit by the epidemic right now. We also need, of course, better legal environments, like smoke-free environments in the country. We have some success in some cities where such laws have been implemented, but we don't have a national law that would actually prohibit smoking indoors. So there's a massive challenge there as well. And of course, we need behavior change. We need to help those who want to quit smoking, that they have the access to the care that they need. And of course, we need to have the education that people are really aware about the risks of smoking and the deadly risks of smoking, so they don't even start or they stop if they have started already.
Now, a movement like this would require inputs and support from so many sectors, the government, partners on the ground, communities, businesses. How does WHO work to build that support?
Yeah, that's a good question. Let me start with a challenge that we have, which really makes our work so difficult and also so important. I've already mentioned the number of cigarettes being produced in China. So the tobacco industry in China is the largest, by far the largest industry worldwide, and it is state-owned. Not only that, so that basically the government makes money by selling products that, if they're used as they're supposed to be used, kill half of its users. But not only that, it's also that the ministry being in charge of the industry, tobacco companies, is actually also put in charge to monitor the implementation of the Framework Convention on Tobacco Control. So there's a massive conflict of interest, which makes it so difficult for us, because the health ministry, pushing for better tobacco control, always has a very formidable negative partner sitting at the same table at the cabinet, making these discussions so difficult. But there's also very good success. For example, we have seen over the past years implementation of very, very strong smoke-free laws in 3 of the 4 first-layer cities. That's Beijing, Shanghai, and Shenzhen, being smoke-free indoors. And these laws are working very well. We have seen an increase in taxes, which for the first time in the last year was actually put on the retail price. Before, the companies have just digested that in their income, but it's now being put on the retail price. And we have seen an effect with the decrease in the number of cigarette sales. Now, these are careful starting points, but one good news which I'm going to share with you today is that we are working actually also with the business sector, and we're going to announce with the business sector and the entrepreneurs of one province in China that business wants to go smoke-free. So this is not only a discussion that happens in the health sphere, it is a discussion where business realizes how important it is to have a healthy population, for healthy business, for a healthy economy. So this is where we are working.
Bernhard, you've just described the challenges, the size of the country, the burden, and all of the other challenges of tackling tobacco. What have been some of the leading reasons for the successes that you've experienced so far?
I think it's honesty, it's the right data that we bring forward, and it's the trust of our partners. It's also walking the talk. I'm out with the volunteers that enforce the smoke-free law in China. I visit them in the mornings when they get out to the bus stops to actually talk to people and try to educate them on smoking. And this really has made a huge difference. So people know me for that, and that makes it much easier also, of course, to drive our work forward in a way that, step by step, I'm sure we will really, be able to handle this massive health challenge in a much better way.
There you have it, non-communicable diseases, the top killers of adults globally. And this is a major topic of discussion here at the World Health Assembly. Now, as people live longer, other diseases are coming to forefront, diseases like dementia. Dementia is a disease about deterioration in memory, thinking, behavior, and the ability to perform everyday tasks. It affects mainly older people. Contrary to what people may think, it is not a normal part of aging. Worldwide, 47.5 million people have dementia, and there are 9.9 million new cases every year. Alzheimer's disease is a common cause of dementia. Dementia is a major cause of disability, and often it causes dependency, straining families, caregivers, and society. Joining me now to discuss this is Dr. Tarun Dua. Welcome, Tarun. You are the Medical Officer, Department of Mental Health and Substance Abuse in WHO. We talked earlier this week about the great accomplishment in increasing life expectancy. Now, dementia mainly affects older people. Tell us, are you noticing a rise in numbers?
So you're right that dementia is happening because the populations are aging. There are more and more people who are getting older. And one of the side effects or consequence of that is increase in number of people with dementia. Just to put the numbers that you mentioned today in a different perspective, 47 million worldwide with dementia, what does it mean? It means that there are roughly 5% of the elderly population who has dementia. You mentioned 9.9 million new cases. What does that mean? One new case every 3 seconds. 1001, 1002, 1003. This means there is one new case of diagnosis of person with dementia. And the trend is increasing. So it is estimated that if today there are 47 million people with dementia, in 2030 they would rise to 75 million. By 2050, almost triple. So this is a problem, but not only in high-income countries, but also in low- and middle-income countries. Currently, 60% of these people live in low- and middle-income countries, and therefore what we think about the strategies, it has to be a global strategy and not only focusing on high-income countries.
Now, Tarun, as we age and as our parents and relatives age, and we think about taking care of them or how will their old age be, we know that one of the concerns is they want to stay healthy as they age. Is there a way to prevent dementia?
So we know that age is the strongest risk factor, and you very rightly said, and I would like to reinforce the point, that dementia is not a normal part of aging. It is a disease, it's a syndrome where a person has problems. And there are many things that you can do to prevent dementia. One of the things that is said is that what is good for your heart is good for your brain. So things like physical activity, eating healthy, preventing obesity, preventing diabetes, prevention and management of hypertension, management of depression, cognitive stimulation, learning, all of these things can lead to prevention of dementia. What we require is awareness of societies, of communities, of policymakers to implement these strategies.
What about treatment? Does it exist?
So right now there is no cure for dementia, but that does not mean that you cannot do anything about it. There is so much that one can do about it, and I would like to emphasize 3 things here. One is early diagnosis, because then you can have an early and optimal management. The second is management of the symptoms associated with dementia, for example, the behavior and psychological symptoms such as wandering, aggression, all of these can be managed. And the other thing is to taking care of the comorbidities, or taking care of the physical health. So you don't treat dementia in isolation. You take care of their diabetes, you take care of their nutrition, you take care of their hypertension. And last but not least, when you talk about managing dementia, is also to think about the health of the carers. Because a person who's taking care of a person living with dementia can have stress, strain, can have physical and mental health conditions, and therefore any strategy should include both person with dementia as well as their caregivers.
Tarun, let's take a question from our audience here.
There's a lot of interest about this topic, and I'm seeing a lot of questions about how do we work with caregivers and make sure that they are being taken care of and that we're providing for them as they're taking care of people with dementia.
So one of the important principles about taking care of a person living with dementia is to have a strategy or any policy that empowers and engages the caregivers and families. So what I would like to emphasize here is nothing for them without them. So, and that includes starting from at a policy level, thinking about any of the management strategies, thinking of the awareness. The third point that I would like to emphasize here is that when you are thinking about taking care of a person with dementia, ask the carer, how are they doing? Provide them support, provide them financial benefits, provide them social benefits. All that are extremely important. And WHO has recently launched a program known as iSupport that provides online training and support for caregivers of people with dementia.
Well, thank you very much, Tarun, for coming on our show and talking about this very, very important issue. Now, this week we've spent a lot of time talking about the work that is being done here at the World Health Assembly. Our next guest is actually going to is going to explain to us how these decisions actually translate on the ground. Dr. Nata Menabde, welcome. Dr. Nata Menabde is the Executive Director of WHO Office in the United Nations. Nata, you're currently working at the UN headquarters, but previously you have worked in a region, in the European region, and you were the WHO representative heading our country office in India. So you have really seen how we work at different levels. Tell me, explain to me how the decisions, the resolutions that are taken here are going to translate into action on the ground.
Thank you very much for this opportunity. And let me start by saying that this is a two-way road and that these decisions are made actually by the countries. So they bring their problems, their issues to these fora, and they then translate that into kind of inter-country collective commitment document. So this is not made without countries, and it's not just top-down approach. So after these resolutions are adopted, and they are sometimes very difficult to reach consensus because there are issues for which there are difference in the positions of the member states. So what happens is that they negotiate, they agree on something, they compromise on some of their particular interests, and then they look forward to implementation. Now, how does this trickle down? Usually, if it is a resolution which is about a strategic approach to some or another problem, then this becomes a regional strategy also, and then regions pick it up and look how, in the context of particular region, there may be some specificities which require a difference in roadmap and application of different approaches to get to the commitments made in the resolution. But then the real life starts when the resolution implementation reaches country level. Every country is different, and they are different also inside the region. Like, as you mentioned, I served in India, but India is not Nepal, for example. So what approach you have to India is not necessarily the same as the other neighboring country may take. So you need to really mobilize all the stakeholders at country level, not just health officials and health workers, but you need multi-sectorial approach, you need civil society, you need private sector, you need everybody to see how you can put a collective roadmap, consensual roadmap at country level. How do you mobilize and allocate necessary resources to make a resolution in reality so that you can back report to the fora such as World Health Assembly or, for that matter, any other fora. As you mentioned, I am stationed in New York and I am representing the World Health Organization at the United Nations. So many resolutions which are adopted here make their way to reach higher level and to influence actually bigger players in the government, such as heads of the states. Like, for example, non-communicable diseases resolution, which was adopted by the United Nations General Assembly at the head of the state level, is built on the issues which are discussed here. Similarly, some resolutions in New York actually influence work in the World Health Assembly here. So it's a very interesting road. For example, the Foreign Policy and Health Resolution, which has been born in Geneva, let me put it that way, but it has been negotiated in New York, and every year it comes with new issues. For example, it has brought up the issues of antimicrobial resistance, of a global conference on tuberculosis. Then there will be high-level meeting which is happening in New York at heads of states level, and their commitments are made. Of course, this is very much connected to the work done at the World Health Assembly, at the high-level ministerial events of health ministers here. They feed into this process, so it's a very interactive process, requires a lot of exchange, communication, engagement of everyone involved. So that's...
Thank you very much for explaining to us and painting the picture of the landscape and the roadmap of how these resolutions will actually result in action and how we work from the global level to reach the people who need our help. Thank you very much for joining us. Well, this is our last World Health plus Social Good show from the World Health Assembly this year. Before we end, I want to thank our partners, UN Foundation, without whom we could not put this, we could not have put this show together. Thank you very much for that. And we hope to see you soon again next time. Thank you very much. Bye-bye.